right, y'all, so I am on the way to my appointment to get this scan. Hopefully they let me record in here. This is to a specialty doctor, so I don't know how they operate in there, but I'll of course I always just ask. It never hurts to ask, especially with my husband not being able to be there. That's how I get away with a lot, like, oh, I need to have this, because I don't remember what to tell him when I get home, or how it went, or how to explain things. So it's just easier for me to document it, but I'm really documenting it for us. Anyway, so yeah, we will see what they say. They sent me something to check in online at like 7 this morning. It's 9:40 right now. I'm supposed to be there at 10. And then they sent it to me and it said my appointment was for 10:30 and not 10, but maybe they want me there 30 minutes early. I don't know, just in case. And then when I was trying to do the check-in process, it was like, oops, something went wrong. I was like, you know what? I don't have time for this. I do not have time for this. Y'all and y'all's technology. Technology is a great thing, but when it does not work, it sucks. But anyway, I will see you guys when I get over to the doctor's office. All right, y'all. Let me show y'all. Parking is ridiculous at this. I gotta go way over there to that building, to the other side of that building. A long ass hike. Like, I really don't understand. This is a freaking hospital. This is Medical City of Plano, Texas. If you ever need anything, don't go there, because obviously they don't have the space. Now, either they pack to capacity with all these different physicians and offices, but who got time to be parking way over there? The baby may come out now just because I had to hike over here. Why would they send me to do this? I'm supposed to be on bed rest, but you got me out here walking 2 miles just to go see a doctor. That's crazy. I sure hope I remember where I parked too. And I look a mess, y'all. I got on a crop top, sorry. I'm trying to keep it down, but I'm in crop top status. But I got on some high-waisted jeans, so you can't see too much. But I ran out of stuff to wear. I ran out of comfortable clothes. So I had to make it do what it do. I guess I could have put on the other option was long johns, and it's hot in Texas. So anyway, I'm gonna get over here, and I hope this wind is not too bad. I'm trying to cup my phone, and so y'all don't hear it. But yeah, so I'm up on the building now. I need y'all's cousin right here to go on. He creeping. But now I gotta go all the way down to where those cars are coming in. I don't know if you can see them, but it's a long way, y'all. Then I gotta wrap around the building. Anyway, let me go, because I know this is boring. Well, y'all see that sign. But I'm gonna just lay it here with me, and we'll see, so you can at least hear what's going on.
All right, 21 weeks.
Yes.
How did you do these? Okay, so that was 2 days ago, right?
Well, yeah, and it was like a spotting, so it wasn't bright red. It was like a light pink.
Got it. Okay.
And not a whole lot.
Okay.
So she's pretty low, yeah.
Okay. And then, yeah, so I was gonna ask you gender next. So we know it's a girl.
Yes.
Okay. So I'm gonna do a full anatomy scan first, and then Dr. Turner will be in to see you.
Okay.
He'll go over things and answer any questions, okay?
All right.
Can you fold these inwards like your pants? So let me undo this part.
I can't see.
So what I'm gonna do is this.
Oh, yeah.
There we go.
Whatever we need to do.
Okay.
I just didn't have anything to put on.
That's okay. I'm gonna lean you back a little bit here. Started feeling her wiggle yet?
No.
Okay. There's heart. I'm gonna zoom in and measure the rhythms. So the placenta's on top. That's probably why you're not feeling any strong movements yet. So it's just basically one more patty between you and baby. Heart rate's 136. That's good. Okay, so I'm gonna come push on you for a minute. Let's look at cervix.
And I have a fibroid somewhere.
I see it.
Oh, okay.
Mm-hmm.
They thought maybe that was what was irritating me. They mentioned that yesterday.
Okay. And then I'll probably want to do transvaginal at the end so I can check the length of this cervix. 'Cause I can't see the whole length of it on top very well.
Okay.
All right, let's look outside the uterus towards the right. And outside towards the left. Looks like you have a couple fibroids.
Yeah.
Okay. So there's one up top here. Are they causing you pain or just sensitivity?
No,
or
she
anything?
won't remove them. She's just said they're not, doing anything. They're fine.
Okay. So we'll just measure them and follow the
Okay.
size of them.
Is baby, she balled up still?
Mm-hmm.
Oh. Yesterday she couldn't get a good profile for me of her because she was in a ball.
Yeah.
They were wiggling her and she just wouldn't.
Let's see if we can get these measured first. Okay, let's take a look at placenta that sits above baby here. And did you do genetic testing with this pregnancy?
Yes.
Okay, everything was normal?
Yes.
Great. I'm gonna look outside the uterus towards the right, and towards the left. I'm gonna measure the fluid around baby. And we're gonna look at where the umbilical cord is inserting into the placenta. Okay, so let's start with, yeah, baby's got those legs up and over the head.
Oh.
There's a leg, or there's an arm, and then there's a leg, and then there's the face behind all of that.
Oh.
So, having a hard time seeing face. I can see little eye sockets and
Mhm.
chin.
But that's all she's getting. She's ridiculous.
Hopefully she'll move out of that spot.
Yeah, she used to stay like elongated and she'll be twirling and things, but now she must, I guess because she's growing, she's getting bigger.
I don't know, sometimes they just do what they want to do in there. I'm going to follow the spine down the back here. Okay, I'm going to look at arms and legs next. Bright white lines are bones. There's one arm. between the legs. Alright, now the legs. And there's one leg stretched out. And the other leg. All the body parts are over the top of the head. Tiny foot. See if we can get the other one. Wiggling those toes around. So 1 foot here, 1 foot here. Okay. Start measuring. This is the femur, main bone in the thigh. Bladder. Umbilical cord. Girl parts. Okay, coming up to the stomach, heart, kidney area.
Ken Trimmer, you doing okay?
Yes.
Well, getting some good news.
Okay.
Say no surgery today.
Today?
No surgery today. Let's see. Doctor says age and IVF, and we're going to add on to that BMI and first pregnancy. At least one.
Oh, I have several.
Several. And you didn't list baby aspirin on your medicines list.
Oh,
Are you on baby?
I am on that. I'm
Okay,
sorry.
That's
I was thinking prescription meds.
That's
and
okay. That's where I was heading. I was heading.
Okay.
I was heading to the baby aspirin talk.
Yes, I have.
There
I
you
take
go.
one a day.
Yeah. So that's for your risk of toxemia, preeclampsia.
Okay.
So Morgan's got 13 ounces, 3/4 pound, 9 inches head to toe. Is all normal for today, normal size. On track for early part of the year, next year.
Okay.
27th it says. And then, let's see, let's do this picture first. So this is your cervix. So there was a question about your cervical length or if you were short or dilated or whatever. So this is that internal exam, and that's perfect. Maybe got a little tiny Nabothian cyst at the tip of the cervix, which is kind of like cervical acne.
Okay.
Just a little clogged up mucus duct that makes the mucus plug. And so that's probably all that is. And then you got this fibroid under your cervix. So one of the comments, the cervix is fine. So one of the comments to doctor is yet to be seen. You haven't had myomectomies or anything like that, have you?
No.
Yet to be seen is will the baby actually be able to maneuver past that cervical fibroid?
And see, I kept asking them that they need me to remove it even during IVF, and IVF wasn't concerned, and my regular doctor, once I transferred to her, she wasn't
concern.
concerned at all, so I'm just stuck now, like.
Mine, yeah, exactly. Mine's more of a location comment. Is
Okay.
I don't know that it's, you know, it's relatively sizable. I mean, it's probably the size of a big egg or tennis ball.
Okay.
And so what I write down is it may block the birth canal. And so the two comments I write down, one is that you have a cervical fibroid that may block the birth canal.
Okay.
We'll have to wait and see. And the other is the area of your C-section incision is fibroid free.
Oh.
And so it's just a note to the doctor to say, well, there's nothing in the way from where the incision would be made for the C-section. So should that be necessary, then at least that part's clear.
Okay.
And if there's something there, we write that down too. So we usually say there. Okay. Anyway, moving on. And then the baby, yeah, baby looks good. You have quite a few placental lakes. These little dark areas in the placenta.
Okay.
I don't know if that's part of the IVF process. We do see them maybe more frequently with IVF pregnancies, but these little dark areas under that's baby's placenta.
Okay.
They're called lakes or old infarcts. They're areas of capillary separation and fracture. They may or may not be associated with some spotting in the pregnancy early on. You've not noticed any?
I spotted in the first trimester a little bit, and
So they are sometimes what we call capillary fracture. So they may be symptomatic in some people, not always in everybody. And then, but the majority of the placenta is up high. It's way up to the
and
top.
that's why. Is that why I can't feel her?
That is part of it. Yeah. So at 3/4 pound, you should start feeling some movement anytime.
Okay.
At 3/4 pound, you wouldn't feel daily activity until a pound most of the time. So that's another month. Here's 10 fingers. And yes, the anterior placenta will diminish what you feel high in the uterus, because that's where that's located, is up at the top. So you'll feel more, hopefully you'll notice more down towards your bladder and either side.
Okay.
Good bone and brain symmetry is what we write down. That looks good. Got both hands, 10 fingers, so both of them right on the face. Cushion between placenta and muscle below. Got eyes and nose and lips. And so this is the upper lip and no facial cleft there. Cleft lip. Clavicles and shoulder blades. And then heart chambers. Baby's really curled up there.
Yeah, since yesterday, and she was just moving the probe on me, trying to shake her, but she will not move.
This is top of the heart, aorta, pulmonary valve, and vessel, superior vena cava, and trachea all lined up at the top of the heart, and then heart chambers are here. Septum, that looks good. Heart looks great. About 142 for me, normal. And then baby stomach fills with water as baby swallows. Liver on the top. Kidneys are a little darker gray circles next to the spine. Belly button is across from kidney. And then both legs tucked up on your pelvis. The legs wide open. Did you say boy or girl?
It's a girl.
I think you did, yeah. Yeah, I thought I heard you say that. So labia
Oh,
is
I
there.
see her legs finally. Something I can make out.
Toes.
Yeah.
And then the other foot is crossed and pointing down, so they're a little
Okay.
tougher to count, but there's kind of blurry, but tips of the toes pointing in. So toes there, got 10 of those. And here comes a hand between the legs, there he goes. Now baby's getting active. Kicking. Got an elbow under the hip and both hands are down here now. So maybe start to twist and turn, and maybe I can get the full length of the spine and skin covering there. So neck and shoulders and back and skin and spine above us, and then also aorta concerns and just those comments that we've made is, you know, from the placenta comment and IVF pregnancy and age, there's just a note to check on baby size periodically. Watch this number here, 50 is 8-pound baby, so it says we're gonna be probably not 8 pounds at the due date. And then the comment about the fibroid location at your cervix, posterior cervix, that's easiest to see on the internal exam. And whether or not it's gonna block the root canal.
Okay, yeah.
I don't know. It kinda depends how much it moves and migrates with.
Is there anything I can do on my end, or is this just?
It's that tissue's kind of elastic and stretchy, and
Okay.
so, you know, really what we say is pray that it moves off to the side, cause even if it's, you know, not totally right in the center of the cervix, if it's off to one side, then it'll kind of shift over.
Okay.
And then as that low segment develops for delivery, that stretches, and it actually allows the baby to drop.
Okay.
And so, you know, that's not till third trimester, so it's kind of hard to know what's
Yeah.
gonna happen until you get there.
Okay, so, and am I dilating and all that? Oh, thank
Are
you.
you what now?
Am I dilating, or do I need to
Not
have
at all.
the stitching?
Nope. No,
Okay.
that's the part where I started. No surgery today.
Oh, so okay, I just thought you'd be like, I don't have to go across the street today.
No surgery today.
Okay.
So what we'll do is, I mean, it's worth looking at again, maybe sooner than 4 weeks. I said 4 weeks, but maybe 3. So the, sorry, I lost my picture. Go back to the internal exam, there it is. Yeah, so the cervical canal is normal,
Okay.
not dilated, is the comment.
Okay.
And that's also with fundal pressure, when Morgan pushed on you,
Mhm.
didn't dilate when Morgan pushed on you.
Oh, okay.
And so this is normal, anything above 25 is okay, you're gonna be listed about 45. And then I suspect with that fibroid there, I doubt you're gonna actually have any trouble.
Okay.
But I think it's safest to say,
Mhm.
let's check again in about 2-3 weeks.
Okay.
When you're 24 weeks, the baby should be close to a pound and a half. And so that'd be about 3 weeks away. And so those kids are physically big enough to keep themselves out of the pelvis.
Right.
And so we switch from thinking about cervical weakness or incompetence
Okay.
to preterm labor.
Right.
And you definitely have a risk for preterm labor as well, being IVF and fibroids and things like that.
Okay.
Okay?
All
But
right.
for today, that's perfect.
I
That's a
appreciate
great
it.
picture. Have a good weekend.
You too,
All
thanks.
right, yeah, do call us if there's, and it may be painless, if you have painless, leaking, bleeding.
Okay.
Mucousy discharge, watery discharge, any of those things, let us know.
Okay.